Hey everybody, Miss Hunter here, and today we're going over Chapter 32, Rehabilitation and Therapeutic Modalities. As always, there are your learning objectives listed for you here. So rehabilitation medicine is the field of discipline that uses physical and mechanical agents to aid in the diagnosis, treatment, and prevention of diseases and bodily injuries. The goal is to aid restoration of functions that have been affected by different patient conditions. For those that have experienced permanent loss of ability, it seeks to find practical substitutions for that loss. So think about patients that have lived through a stroke. Perhaps they have no use of one side of their body now. Different rehabilitation medicine modalities will allow them to find substitutions to compensate for that loss. Here we have some different specialized fields of rehabilitation medicine. You can often think about physical therapists in this field, occupational therapists, speech therapists, and even those in sports medicine. The MA, though, also plays a role in rehabilitation. You may find yourself working in a rehabilitation clinic or in a long-term care facility. But even if you're not working directly in the field of rehabilitation, you may be referring patients to different treatments, so outpatient occupational therapy or speech therapy, or even performing different insurance coding or different therapeutic modalities. Care for patients that require rehabilitation medicine is very important. We need to have patience and understanding for these individuals. It's important to remember that patients may be able to perform only limited amounts of ADLs. And remember, ADLs are those activities of daily living. So they may not be able to complete total self-care at this time. It's our job to understand this and encourage those individuals through their recovery process. Here we're going to talk about the principles of body mechanics, and this is important for you as the worker, but also important to educate your patients about. So body mechanics is the practice of using key muscle groups for good body alignment and proper body positioning to reduce your risk of injury. Now, when I was in nursing school, they taught us body mechanics specifically when having to turn patients and move patients while they were on the bed. But this also goes if you're working in a clinical setting where maybe you're at a desk for a long period of time. Having good posture, things like that, will protect your body and have good body mechanics. So just some tasks to do for safe body mechanics and using your body effectively. You want to keep your back as straight as possible and keep your feet shoulder width apart to provide a good base of support. Always bend with your hips and knees, never with your back. You want to pivot your entire body instead of twisting your back when moving different items. Use your body's weight to push or pull, never your upper body, so again, not using that back. Obtain help. There's always people around to help you. Ask for assistance if you're having to move something heavy. If you are holding a heavy object, so perhaps a box of paper or something like that, remember to hold it close to your body. Make sure that there's a clear path anytime that you're moving different objects, and get in the habit of wearing a body support if you're doing a lot of lifting. So some individuals will decide to wear those back braces and such. So a lot of these body mechanics can be thought about when transferring patients. You may work in a setting where you have to help ambulate or have to transfer patients quite frequently. So it's important to remember these good body mechanics in those cases. As I mentioned, it may be your responsibility to help patients ambulate. Remember, ambulation is walking, and it's a functional activity. Obviously, it ensures an ultimate level of independence and freedom, and many individuals that have undergone certain conditions, their goal will be to walk again. Sometimes this may take months of treatment to actually get back to that point. Before assisting with any type of ambulation, there are several safety issues to remember. I want you to look these up in your book, but they're things like wearing safe shoes, rubber-soled shoes that will grip, things like that. So be sure to check out your book for these safety guidelines. Let's talk a little bit about assistive devices. Now, even if you're not working in a rehab facility, it'll be important to understand these devices because you may be working in a clinic where you will provide a patient with one of these devices, or that a patient will come in with one of these devices. So one type of assistive device is a walker. A walker is best used for those that need maximum assistance with balance and coordination. These guys need a lot of stability and a lot of support when standing or walking. Another assistive device is crutches. Crutches give you much more mobility and flexibility, and they do provide good stability and support, but you also can have a broad range of gait patterns and ambulating speeds. So more versatility here and more mobility and flexibility. Canes are used for patients that often have one side that is weaker than the other, and that they need an assistive device for a more longer period of time, longer than a period with crutches. For others that may have a physical disability and mobility is not possible at all, so they're not able to ambulate at all, they may have to use a wheelchair. So here we have a walker. There's some standard features noted here, as well as some considerations. What I really want y'all to pinpoint here is the key to fitting a walker, because you may give a patient a walker, but you need to make sure that it fits them right. So the height of the hand grip should be adjusted to just below the patient's waist, just below the waist, at the top of the femur, at top of the big leg bone. The elbow should be bent at a 15 to 20 degree angle. So not straight, not stiff straight, and not really, really bent. At 15 to 20 degree angle so the hands can rest on the hand grips. There are different types of walkers. Notice here in this picture there are ones that have 4 wheels or ones that have 2 wheels. So just note that there are different features. Some considerations to take in effect would be that patients that need ultimate support and balance may need just the ones with the 2 wheels. Let's move on to crutches. So here we're looking at axillary crutches. These are the most common type of crutches that we think of, and these are placed under our axilla area, our armpit area. These are not really recommended for our older adults because they already have a lack of balance. Better for our younger individuals, and provides the greatest range of ambulation. Some keys to fitting these properly. The patient must be standing tall to measure appropriately. They need to be wearing good shoes, and the pad of the axillary rests need to be 2 to 3 finger breadths below the patient's axilla. So they do not need to be way up underneath the armpit. They actually need to be 2 to 3 finger breadths below. A lot of people make this mistake and they're actually leaning their armpits onto these rests. That is not how they're supposed to be used. The hand grips are what are supposed to have the most weight put on them. And your hand grips should be at about a 20 degree angle when you're placing your hands on those hand grips. Here we have a crutch, a forearm crutch. These are shorter than axillary crutches, and they have a metal cuff worn around the forearm. These are a little less stable than axillary crutches, and they're better for long-term use. The height is adjusted so that the elbow is flexed to a 15 to 30 degrees. The crutch should contact the floor 2 inches laterally and 6 inches anteriorly to the foot. Another type of crutch here is a platform crutch, and it's a platform that's affixed to your forearm. So you'll see here in this picture how his forearm is in this crutch and affixed to that. This is good for patients that have arthritis or don't have a good use of their hands. And here we want to make sure that when we're fitting these, the crutch should contact 2 inches below the skin fold of the armpit. So sometimes they go all the way up around the elbow up to the armpit. And the lower cuff should lie 0.5 to 1.5 inches below the back of the elbow to avoid bony contact. So this one may even be a little bit too large. We want that 1/2 inch to 1.5 inches so that it's not hitting this elbow bone. There are different type of gaits or walking patterns that you can do with crutch walking. I do have different videos here for you guys to check out, and it's really interesting all the different ways that you can use crutches to walk. Moving on to another assistive device, which is our cane. The features, it's a single leg, right? It only has one leg touching the floor. Curved handle, rubber tip to help from slipping. Remember here when we're fitting the patient, we want the cane in hand with an elbow bent at about 15 degrees. Another type of cane would be our quad or 4-point cane. Here you'll notice that there are 4 points to the bottom of this cane, whereas the other cane only had 1. These are better for patients with more severe conditions that need a little bit more stabilization, but the same fitting principles apply to this type of cane. Another type of cane, which is actually called a hemi-walker, is shown here, and it has 4 legs that come up all the way to a handlebar. This is going to provide a lot of stability, the most stability out of all of our canes, and it's good for those patients with hemiplegia, so ones that have no control of the side and need total support on one side. With the arm hanging down relaxed at their side, the top of the cane should be even with the wrist, and this is when we're fitting a patient for that hemi-walker. Our last assisted device for those that cannot obtain any type of mobility would be our wheelchairs. Mobile chairs that enable patients with severe ambulation conditions to get around. Some are motorized and some are manual. There are even wheelchairs that enable patients to participate in sports. I know you've all seen different sports like different races and basketball and things that patients can participate in with wheelchairs. And of course, car manufacturers do modify specific cars to accommodate wheelchairs. So moving on past our therapeutic, our assistive devices, we're going to talk about therapeutic exercises. The first thing we're going to talk about is range of motion. So range of motion, or ROM, is the amount of movement that is present in a joint. Our normal ROM varies among people and depends on different factors. We can measure our joint motion or our range of motion using goniometry. Goniometry, or that joint movement, is measured using a goniometer. That's the actual device that we use to measure that joint movement. Range of motion evaluation is one of several tools used when developing a therapeutic program for a patient. As an MA, you need to be familiar with different range of motion exercises because they are designed to maintain joint mobility. So you may be tasked to educating the patient about different exercises, range of motion exercises that they can practice at home. There are different muscle testing as well, which evaluates the motion strength and task potential of a given muscle. So types of therapeutic exercises. There are many different types that we'll talk about here: active, passive, assisted, and active resistant exercises.